Hi, this is Dr. Watson again with another installment of Spinal Facts. We had Spinal Facts 101 and 102, and to review just quickly, please review those because the information is very important concerning your spinal health. Just in quick review, we talked about the importance of standing straight. From the side, we should have a cervical curve, which is a lordosis. Thoracic curve is a kyphosis, a lordosis again in the lumbar spine, and the sacrum is a kyphosis. What happens, quite frankly, is this. When we lose and deviate from this, from erect posture, the body literally fights itself. It's like a virus, but physical. And we see this with almost every patient that comes in. With 15,000 patients, this is one thing that stands true with everybody. Once you even lose 5 degrees, the body fights itself and it's not as strong. So we talked about in the last video about in the car, in quick review, making sure that when you chronically are in a car that you're not bent over. Because this adds up the commute time and this puts the spine. So when we put the back of the seat more forward and it comes up, this is going to help. So the two factors I talk about are sleeping in the car, and one thing that you can do at home that is so helpful is what we talk about supine activity. I give this to all my patients. So what happens is when you lay on the floor, and you can use a chair. And the great thing about a floor is this, it's anywhere in the world. You could be anywhere on vacation, stop at a rest stop and do it for 20 minutes on a picnic table. Anytime you can put your legs up. I have over-the-road truckers doing this in their sleepover cabs. Their head might be at the gear shift, but it helps tremendously. When you lay on your floor, it accomplishes a couple things that are very germane to your health. One thing is this, any deviation left or right in the spine that causes a twist or torque in your spine, this will help push back as water finds its own level. The body against the force of gravity in the floor will do this. And the other thing is, so we got the spinal rotation, or if you have pelvic rotation, what will happen when you lay on the floor? It'll push them to neutral. And the last thing that's very important is this. When you have a kyphosis and the back of the vertebra, which is the posterior part, and they call them facets, this will help close them down as you lay down, okay? So I'm gonna demonstrate that, and I also have one caveat that really helps. I don't want you to start with this, but you can use something as rolled up as a towel or something as a small pool noodle, not too aggressive, because when you lay, there's a lot of leverage. So just to show you quickly, so I'll use this chair, and you can use anything at home. It's important that you don't use anything too high because it puts a different angle, and bed does not work. Most patients come back and said, I did in bed. Doesn't work because it's not hard enough. Even if you have a hard floor, you can put a blanket on it. So when you lay down like this, and you put your legs up 90 degrees and lay back, not only does it feel good, but it puts your body in a neutral position, and it's free. You have to do this at home. Even if people without time, sometimes you can sleep like this an hour. The two things also that are very difficult, if you have small kids and animals, they like to jump on you. Now, when you want to add the extra, and this is after you've done this a while because this can be very aggressive, you can move this in the problematic spots that you have. Say for instance, the mid-thoracic spine, and lay back. This puts an extra fulcrum, and doing this at least 30 minutes to 45 minutes is very helpful. So most of my patients, I like for them to ask me where we'd like to put this fulcrum because this can be aggressive. So please do this. If you feel like that this is causing pain, I would like to have spine V checkup before you do this. If not, please do not use the aggressive part of the pool noodle. And this is to help patients, and there's such a huge difference. My patients who do this, they get better quicker. And what I really want to do is this. My philosophy in the office is simply this. I give you the key, and what happens is this. When the spine is locked, we have to get mobility first. If you try to do this, it's too aggressive and all these joints locked. But when I get manipulation and get your body moving, as we put it down here, you get gentle motion, then we get the motion. So I give you the key, and when you start to stand up straight and do these exercises, you open the door, quite frankly. So I give you the key, you open the door, but it takes both of us. It's skin in the game. So this has proved very helpful. And there should be no detriment or any precautions to doing this exercise at home. So again, start off slowly with this, maybe even 15 minutes to 30 minutes, and you can consult our office if you have any questions about it, but please work this into your daily life because it's very helpful. All right, great. Have a wonderful day.